Un minuto más, Eli, por favor. Caro está terminando de ajustar aquí sus audífonos.
No, esqueci. Estimadas y estimados participantes y panelistas, es un honor
Dear
para mí
panelists and participants, to me it's an honor to give you a warm welcome to the third and last edition of the PPP Talks. This is a key event in our pathway towards PPP Americas 2025. This event is being broadcast live through YouTube and the big channels with simultaneous translation into Portuguese, English, and Spanish. The objective is to promote the exchange of knowledge, experiences, and best practices around the public and private partnerships. This is a key tool to develop the sustainable infrastructure that is resilient in our region. Throughout this morning, we are going to explore some crucial topics such as the evaluation and also the impact of projects. These tools of evaluation are essential to make sure that the APPs will be not only efficient, but also beneficial to our societies, making sure that they can continue to be engines for the development of our social and economic realm. To kickstart this meeting, I would like to hand it over to Emerson Castro, the General Director of the Promotion Policy for Private Investment in the Ministry of Economics and Finance of Peru. Go ahead, Emerson. Hello, can you hear me? Can you hear me well? Good morning, everyone. Thank you so much to all the representatives of BEAT on behalf of the Ministry of Economics and Finance and to all the representatives of public and private initiatives here. I am very happy to be a participant in this event, the number 3 of our PP Talks, to talk about the social development and the alliances of public part and private institutions. So this is going to be the last kickoff for the main event in April. As Carolina said, this event is of the utmost importance to talk about the growth and the economics of the country, and also it's a public mechanism that enables one to get close to investors and do a proper use of the private resources to develop the public infrastructure in a way that the state can actually contribute in the best deadline and generating sustainability as we go. This is the importance to maintain and have a positive impact in all social projects. It's important to note that the Ministry of Economics has highlighted that this year in 2020, last year, 2024, we overcame the last mark by $9 million, and we had different projects in the infrastructure space to work in different PPPs. We have a task at hand, which is a big one, because this mechanism is of the utmost importance for the development of Peru, and for 25 and 26, it would not be different. It's important to note that with the ministries, we are conceiving some new mechanisms of private and public investment in a way to accelerate the process of investment in some concession contracts that are definitely going into these new investments and these new processes so as we can move forward in the infrastructure that the population requires. Additionally, we are talking about different procedures, we are talking about different changes in the contracts and the decentralization in the national level, and obviously we are going to get into that as we get to it. Now with BID, we are also developing our infrastructure plan and a very important and detailed plan to move forward with our activities. And it's also important to emphasize that we are improving our relationship and enhancing that relationship. It becomes more and more clear the commitment that the Ministry of Economics has to continue to coordinate alongside the public activities and alongside the different ministries and departments to make sure that our portfolio of projects, our PPPs, and of course, with that, I include all the pro inversión activities. All of that can be done in the right time, in the right deadline. So I think that is an excellent way for us to continue to identify new possibilities. And I'm really happy to be
Gracias a
here.
ti, Emerson, por sus palabras. Y
Okay, thank you
ahora
so much,
introduce con la
Emerson.
palabra Tomás Erebrisque,
And
gerente de
now,
infraestructura
Tomás
de
Príncipe
BID. Adelante,
from
Tomás.
BID. Tomás,
Muchas
you have the
gracias,
floor.
Carolina, y muy
Thank you
buen
so
día
much, Carolina,
a
and
toda
good
la
morning to
audiencia.
everyone.
Muchas
Good morning to
gracias,
all
Emerson,
the audience that
por tus palabras.
is watching us online as
Un
well. Thank you so
placer
much,
para mí
Mr.
dar la
Emerson Castro, for
bienvenida,
your words.
como
To me,
adelantaba
it's a
Carolina,
pleasure
este
to give
tercer
you
y
a
último
warm
evento
welcome. Just like Carolina said, this is the third and last event
entonces, con
in
este
preparation for the
PPP Talk
PPP
3
Americas. So
cerramos
with
una
our
serie de
PPP Talk 3,
encuentros
we are
diseñados para
concluding a
fortalecer
number
el
of encounters
conocimiento y
that
las
were designed to
prácticas en
strengthen our
asociaciones
knowledge
público-privadas
and
en
our
América Latina y
practices in the
venimos
partnerships of
promoviendo
public and
el
private
diálogo,
realms
la
in the
reflexión
Caribbean
y
and
el
Latin America
intercambio de
to promote
experiencias entre
dialogue and
nosotros.
exchange of
En
experience
esta
between all of
edición
us in these regions.
vamos a poner
Now,
el
in
foco
this
en una
edition, we are
definición
going to focus
fundamental de
on
las
one
PPPs,
dimension
que
which
es su
is essential
evaluación
from a
y la
PPP
medición del
perspective,
impacto.
which
Y
is
la verdad es que esta es
evaluation
una
and
dimensión que
measurement
está
of
un
impact.
poco
Now, this is a
olvidada o
dimension that
minimizada
has been
en la
perhaps a little bit
discusión, en el
overlooked
debate
in
de
all of this
políticas
discussion, in the
públicas
debate of
acerca
public
de
policies
sobre
overall
las PPPs.
when it comes to the
Porque más allá de las
PPPs,
cifras
because
de
beyond the
inversión, de
numbers of
movilización, de cuántos
investment and the
proyectos hacemos,
mobilization and
es
how many
clave
projects we are
evaluar
doing, it is
cómo
very
estos
important to
proyectos
evaluate
impactan
how
la
these
calidad
projects have an
de la
actual
provisión de los
impact in the
servicios y por
quality of
supuesto
the
la
provision of
competitividad
services and,
de
of
las
course,
economías.
the
Como muchos de
competitiveness of
ustedes ya
our
conocen,
economies. As
desde el
many of
MIR
you are already
fuimos
aware,
pioneros en
we
el
were the
desarrollo de una
pioneers in the
herramienta de
development
diagnóstico
of
que nos
a
permite
tool,
explorar
of a
cómo
diagnostics tool
perfeccionar
that
el
enables
entorno
us
habilitante
to
para el
explore how
desarrollo de
to
las
enhance and
PPPs
perfect the
eficientes y
development of our
sostenibles. Esta
PPPs in an
herramienta
effective
la
and
llamamos
sustainable way. And this
Infrascopio, que
tool is
desarrollamos junto
called
con
Infrascopio,
Economist.
which we
Entonces,
developed with
¿cómo
the Economist
funciona esta
Impact.
herramienta?
So how
Esta
does the
herramienta
tool
genera
actually work?
alrededor de
Well, this
100
tool
indicadores con
generates
los cuales
around
elaboramos un
100
análisis y
indicators based on
recomendaciones de
which we
mejora
generate an
en todo el
analysis and
entorno
recommendations to
habilitante para
make
el
improvements
desarrollo
all
de las
across
PPPs.
the board to develop the
¿Qué nos
PPPs.
muestran estos resultados?
And what
Y
do
aquí
the
esto hay
results
que,
show?
son buenas
And at this
noticias
point,
y hay
I have some
que
good news to share,
remarcarlas,
and we
hay que
have to definitely
felicitarlas y
emphasize
América
that we have
Latina
to
ha
get the
mejorado
word out
muchísimo
because
el
Latin
entorno de
America
las
did a great
PPP
job in
desde que
improving its
se construye
PPP
y se
space
desarrolla el
as we are
Infrascopio en el
building and
2009.
developing this
Para
new
darles una
tool.
idea,
So just to give
en
you
ese
an
entonces, en el
idea,
2009, solamente un
in
país en la región, Chile,
2009,
contaba con
just one
todos los
country in the region,
componentes
which was Chile,
de las
had
dimensiones
all of the
regulatorias,
components in
institucionales y de
terms of the
planificación
regulatory space,
necesarias
in terms of
para
all the
poder
necessary
desarrollar
planning to be
APPs
able to
eficientes y
develop
sostenibles. Y
efficient
hoy en día,
PPPs in a
esa cifra
sustainable
pasó
way.
de un país
Now,
de
these
Chile a
days,
casi
that number
20.
went from
Y
one
esto
country to
realmente
almost
son buenas
20
noticias.
countries. So this is
Pero
definitely some excellent news.
tenemos una
However,
asignatura
we do
pendiente
have
y esa
a
es la
pending
capacidad de la
signature,
región
which
para
is the
evaluar sus
ability
proyectos,
of the
para
region to
ex-ante,
evaluate its own
ex-post y
projects,
implementar,
both
pensar
during and
mecanismos que
post project.
permitan
So we have to
conocer
consider this
con detalle
exercise
el
to be
desempeño de
able
los
to get to
proyectos. ¿Para
know
qué?
our
Para
projects
alimentar
intimately, know
el
about their
diseño de los
development,
proyectos
and
futuros,
with
¿no?
that we can
Aprender
feed
de lo que ha
into the
funcionado bien
design
y de lo
of
que
the
no ha
programs
funcionado
for
bien.
the future. We have to
En
know
este
what
sentido,
works
sí,
and
les
what
tenemos
doesn't.
buenas
So
noticias.
with
Solo
this
uno de cada
background,
4
of course,
países de la
only
región
1 in 4
tiene algún
countries of the
mecanismo
region
formal para
has some
integrar
type of
lecciones
formal
aprendidas de
mechanism to
proyectos pasados,
integrate lessons
proyectos
learned with
recientes y
projects,
proyectos.
both in the past and the
Y en
present.
ningún
So
caso
we
se
still have some
aplican
work to
los
do.
principios de
In no
manera
case is
consistente en
that
el
more
diseño de
clear and more
PPPs.
consistent than
Solo
in the design
7
of
de
PPPs.
26 países de la
Only
región
7 out of
publican
26
reportes o
countries
datos sobre el
in the region
desempeño de
has
sus
reports
proyectos,
on the
tanto activos
development
como
of their
ya
projects,
sean
both
futuros.
active as well as the
Entonces,
ones that are
¿qué
already
estamos
concluded.
haciendo con este
So
diagnóstico,
what
con esta
are we
situación desde el
doing
MIR?
with this
Bueno, nos pusimos
diagnostics,
manos
with this
a la
situation?
obra.
Where? Well, we
Por
are
un
getting
lado,
active with it, and on the
profundizando
one hand, we
en
are
los
getting more in
diagnósticos
depth
y
on the
entonces el
diagnostics So with Infrascopio, in the last two editions of the tool, we have now a new specific module to measure a lot more detail when it comes to the impact of the APPs, the alliances, public and private. We have roughly 20 performance indicators. On the other hand, we have APPs of evaluation, which supports the countries of the region in terms of their projects, in terms of their policies, and we are already working with 4 countries in a very close way. We're working with Brazil, Colombia, Chile, and Peru, and we hope to be able to open up the door for many other countries in the future. And the last point is the dialogues, like the one we are having today. It's all about sharing the experience. This is one value which is really important. We really want to learn from all of our peers in terms of what works, what doesn't work, and how we can work together based on our experience and do a better job in the future. So I believe that these dialogues are of the utmost importance to be able to improve our work, and I'm sure that we're going to have a fantastic journey ahead of us in terms of learning, having a great dialogue, and I hope that we'll be able to see it up and running in PPP Americas 2025 in Lima, Peru. Greetings.
Muchísimas gracias, Tomás, por sus
Thank you so
palabras.
much, Tomas, for your words.
Pasemos entonces al primer panel,
So
donde
now let's
Ángel
get to the
Suárez
first
Alemán,
panel
el
with
coordinador de
Ancor Suárez
conocimiento del
Alemán,
PPP,
the coordinator of
nos
knowledge
guiará en
for
la
the APP
reflexión
team.
sobre cómo
He's
la
going
información
to
exacta y
guide
ex
a
post es
reflection about
fundamental para el
how
éxito de estos
these topics
proyectos.
are essential to
Ancor,
the
adelante.
success of our projects. Ancor, you have the
Muchas
floor.
gracias, Caro, y muchísimas gracias
Thank you so
a
much,
Emerson
Carol.
y a
Thank you so
Tomás por
much
sus
to
palabras de
Emerson and
bienvenida. Para
Tomas
nosotros es
for their opening address.
contar
To
no
me,
solo
it's really a
con ellos
pleasure
hoy,
to be
sino
able
con
to
los
be here
excelentes
and to have
panelistas que van a estar
all these
fundamental
excellent
en este
panelists
primer
that are
panel
going to
y
have
en
a
el
fantastic
segundo.
discussion for
Como
sure.
bien decía
In the first panel
Tomás,
and the
nosotros
second
tenemos
one, we're really
la
looking
suerte, el
forward to it.
privilegio de
We are
trabajar con
fortunate
líderes
enough
y
to be
anteriores de
able to work
evaluación,
with some of the
como
leading
Perú, Chile,
professionals in the
Colombia
area
y
with
Brasil.
between
En
Peru,
ese sentido,
Chile,
hemos querido extraer estas
Colombia, and Brazil.
experiencias
So again, we
estos
want
dos
to
paneles de
bring
discusión,
this
uno
experience
un
to the
poco
table
la evaluación
in
de
our
la
panel of
lectura
discussions
las
and talk
experiencias
about the
existentes,
development
y
of
el
this
segundo
recent experience. And of
la
course,
manera
in
de
the number
unificar
2 panel,
conocimientos en
we're
torno a
going
la
to talk
evaluación
about
de impacto,
unifying
pero conocer de la
concepts
mano de
and
estas
the
de
evaluation of
de estos
impact
cuatro
in
países
the
con los que
APPs.
trabajamos,
So
países
yeah,
punteros de la
these
región,
4 countries are the ones
PPP,
that we work the
y que tienen
closest with,
un acervo
and they have a
proyectos,
great
de
experience.
documentación
They
que
have a number of
permite la
projects and
realización de
documentations
ejercicios de
that
evaluación mejoran
enables
la
them
práctica continua, la
to
evaluación continua
improve their
de
practices
proyectos de
continuously,
infraestructura en
and
general
they
y de
can
APP
have
en
better
particular.
infrastructure
En
projects,
este primer
especially for
panel tenemos
APPs. So
el
in the
placer de
first panel,
contar con
we
Luis
have
Eduardo
the pleasure of
Acosta,
hearing
presidente de
from
la
Luis
Comisión
Eduardo
Nacional de
Acosta, the
Infraestructura
Vice President
Nacional y
of
en
the
Colombia.
National Agency of
Luis
Infrastructure
Eduardo ha
from
sido clave en la
Colombia.
estructuración
Luis Eduardo
de
has been a
importantes
key
proyectos de
player in
infraestructura en
structuring a
Colombia, y
number
del
of
cual
projects for
estamos
infrastructure in Colombia,
orgullosos, y a través
and
de
we
la
are
red
very
APP,
proud
de apoyar
to have him
a la Agencia
as a
Nacional
partner
de
in our
Infraestructura como
APP
proceso de
effort.
evaluación. También doy la
We also
bienvenida a
have,
Claudia Camp,
and we
ella es
give
jefa del
a warm
Departamento
welcome
de
to
Operaciones de
Claudia Kam,
Infraestructura
the
Hospitalaria de la
lead
Dirección General
of
de
the Department of
Concesiones de Chile,
Operations in
y ha
Infrastructure for the
liderado la gestión de
hospitals
proyectos en el
and
sector
concessions in
hospitalario
Chile,
en
and
el
she
país,
has led a
de
number of
forma muy
initiatives in
destacable
the
para
hospital
el
sector
bienestar
in the country, which
social,
of
donde
course
tendremos
is a key
el placer
department
de
from a
escuchar la
social
palabra
and
con
economic
mera
perspective.
supervisión
So it'll be great to
de
hear
datos
about the best
de
practices in this
infraestructura social
sense.
para los hospitales. Y a Rogerio
And we
Marcondes,
also have Mr.
el
Rogelio
CEO de
Marcondes, which
Salog
is the
en Perú,
CEO of Salog
líder en
in
el sector
Peru,
de la
also
logística
a
en Perú,
leader
con
in the
amplia
sector
experiencia
of
en proyectos de
logistics in
infraestructura
Peru, has worked
público-privada
with
y
many
precisamente
projects of
esta combinación
infrastructure,
de
both
infraestructura que
public
va más
and
allá
private.
de la tradicional infraestructura
And
económica,
again,
conocido por
his knowledge goes
amplio
beyond the
asesoramiento,
traditional
mentoría y
knowledge of
recomendaciones, pero que también
just logistics and
hay un valioso
communications.
contenido traer con
He
este
also
panel,
has that outlook
ampliar
from the
la
private
frontera de
sector
conocimiento en
perspective
cuanto
to expand
a las
that
prácticas de
knowledge when
evaluación
it comes to the
de
practices
desempeño,
of
impacto en sectores
evaluation
claves para
and the
la infraestructura
performance
social,
for some
como es el
key
sector de salud.
sectors as it
En
is
este
with health.
caso, me
And
gustaría
so in this
empezar
case, I would like to
con Luis
start
Eduardo
with
Acosta,
Luis Eduardo
presidente de la
Acosta.
AMI, y preguntarte, Luis, bueno, en primer
And
lugar,
I would
darte
like to,
las
well,
gracias
first of
por
all, Luis
acompañarnos
Eduardo,
hoy
thank you
y
so
por
much
compartir
for
tus
being
palabras con
here.
toda la audiencia
We are
que nos
big fans
acompaña,
of your
y
work,
escuchar un poco desde
and
tu
we would love
lado
to
qué
hear
cambios
from you
significativos has
what were
observado en el
some of the
proceso de
significant
evaluación
changes
ex
that you
ante
observed
como
in
ex
the
post en los
evaluation
proyectos APP
process?
en Colombia
What
a
was
lo
it
largo
like
de
before
estos
and
últimos
after
años.
this
Muchas
project in
gracias.
Colombia?
Adelante.
Thank you so much once again. Thank you very much, Anchor, and all the our fellow panelists. A very good morning. It is a pleasure for us to be here and contribute to this event. It's great to have this exchange of information. So, to your question, and thank you so much, this is a very important question, and it's a pleasure to me to say that Colombia has had some very significant changes, and we were able to focus more in garnish some learnings with our projects. I think the main change that we've experienced in the last few years was back in 2011 when the government actually created this agency. With the concessions that we received from the government, we started working and putting some projects together, working with different entities that were also available for, different executions in public construction projects. And considering the legislation we had in 2012, which enables us to garnish this initial experience and do some more technical projects and also do some parallel financing strategies to be able to combine some payment mechanisms and do significant progress in this way. So when the agency was first created, we had a fourth generation of concessions in Colombia. We were working in between projects, and these projects, they were conceded. And with that, the roadways and highways in Colombia were duly adjusted. They were renovated. So with that, we were able to do a nice refurbishment in our roadway system. And with that, of course, the competition level of the country improves, logistics improves. And with that, we learned something that is really important that I believe it's important to note. You always have important logistics challenge to tackle. It's really important to focus on those right away. And in Colombia, we have a number of challenges, as it is known, right? So in order to take that step, in order to bridge this gap, we put together a document of public consulting, which is known as the 4060 document here in Colombia. And that enables us to work with different projects, and within these projects, now they can be carried out as far as the roadway projects as well as the airport projects and also the ferries that are necessary to connect different regions of the country. With that, we actually have a corridor of 500 kilometers in logistics. We're going to do an investment throughout 5 years to improve that back and forth, to improve that corridor of logistics. And here in Colombia, well, unfortunately, everything that has to do with this aspect presents important challenges, but that's what gets us motivated to work in the future. And of course, this is all based on the learnings and the feedback that we constantly give with our peers. So we are working with BID. We also have to consider that we have some important indicators that might be permanently fed and continuously fed by our agencies. So with that, we have some contracts that are evaluated based on this experience that we already had. And with that, we can definitely focus on moving forward. Thank you so much, Luis. In this first round of questions, we are going to hear from the different panelists. And with that, we can have some additional reflections back and forth. In this sense, I would like to hand it over to Claudia Khan. She can tell us a little bit about her perspective in terms of how they improved the monitoring segments of the APPs from a hospital perspective, and what are some of the key learnings that may be applicable to other countries based on the Chilean experience. Thank you so much once again, Claudia. Thanks to you, Anchor, and good morning to all the audience that is joining us online. Well, in our country, for 16 years, we've been working on that. We've been working with PPPs in our hospitals. The first contract was actually in 2009 with the hospital La Florida. And from 2020 to this moment, we've been working with different projects. We actually have 20 additional hospitals with 20 additional contracts at this point. So to us, yes, definitely, it has been quite a long way. There's been a lot of development. We've been monitoring multiple projects in different stages of completion. And again, with the PPP model here in Chile, we have a lot of data that we work with, and we work with the healthcare, the public healthcare system in the country. There is a legislation that is applied to all the existing projects, whether it's civil construction, hospitals, or roadway construction, railroad construction, anything. And there are some service indicators that enable us to continue to monitor the behavior of the project to make sure that we are on point and motivated. And by 2020, we had a number of hospitals that were operating. And so we thought that it would be important for us to monitor and set some goals, to have a nice comparison, and to know exactly what we were, if we were actually hitting the mark as far as our objectives. The Ministry of Public Construction, as it's called, decided to work with the hospital contracts and also with the construction schedule. So in this sense, we put together a recent infrastructure to work with the data and everything that is, everything related to contracts, to update the documentation. And the Ministry of Public Construction has been putting together some very dedicated projects and including some interesting profiles. We are working in 4 hospitals at the moment. Between 2025 and 2026, we'll continue to work with them. And we are also including some platforms. We are working with some platforms that will enable us to work with each contract that we have. Each of the contracts have 120 to 130 indicators and levels of completion, and all of that is within the concession. So we have many services that are also part of the PPPs. So this platform, not only does it cover projects, but also services. So in that sense, we get real-time reports to assess the completion of the activities scheduled, and we see all the dependencies as well, the activities that haven't been performed. So with that, we have a nice overview. We stay on top of the data. It's clean, real-time data. We know how the contracts are going. We know which modification needs to be done. And with that, we can also do a good job of assessing the efforts so far, which parts of the contract need to be adjusted or tweaked. So this platform enables one to make decisions whenever we face an issue, whenever we have a new demand that comes down the pipe, or anything that could require more of our attention, or that maybe it's more urgent. I think it really puts us in a good position, to understand what the priorities are. So with that, we know where to focus our efforts and define the right criteria, define the priorities, and it seems, it really helps the infrastructure of organization. It's really essential to have this type of mechanism to be able to establish some follow-up and to have a cross-sectional operation in the projects. And in this sense, to us, it is really helpful to have that data control and this control of follow-up of the projects, since the beginning all the way to its conclusion, and all the concession contracts being monitored and assessed as based on in this tool. So yeah, this follow-up that we do is a constant process. And that enables us to pinpoint some very important information about the projects. The first thing is the good practices with regards to the coalitions we have and how to work with the concessionaries, and also the procedures with the Ministry of Health and the Department of Hospitals. And on the other hand, which is something really important as well, it helped us to generate a continuous follow-up process. All these indicators that we can have based on this platform that I was talking about, that gives us the indicators and the levels of service and enables us to do a more of an overview. That also lets us know the necessity for change in our concession. In other words, hospitals are really dynamic, right? In the operation, it's really hectic, especially after COVID. And we detected that the need for hospitals was actually much greater than the infrastructure that we actually had. So the contract of concession didn't really have some mechanisms that were flexible enough to do an important change as COVID required in our country. We're simply not prepared. So we evaluated it and we considered that it was really important to have mechanisms for contract flexibility. A lot of the challenges we faced before the pandemic, they were caused by bureaucratic and by red tape issues, really contract issues. So it was really important to get a good view on that. So right now we can generate the proper admin processes going beyond the first necessity, going beyond just, gathering information. And with that, we can get to the construction stage, which is really, really relevant for us. A great deal of observation that you can have in terms of how the infrastructure operates and how to maintain that infrastructure is always valid. You should definitely focus on it. So with that, we took a great deal of data that is available. We do a better job assessing it. We can make decisions based on that data, improve the metrics of that contract. We can do a proper assessment of these contracts, and this excellence in operation translates into the execution. So yeah, part of the experience and is really about maintaining a continuous follow-up process and maintaining a good communication channel.
Nosotros en Chile todavía no hemos pasado por una experiencia de relicitación, recién la tenemos que programar para el 2030.
We really have to focus now on the 2030 projects. This is what is on our scope. And of course, we had some fantastic experiences to fine-tune our contracts, really. Part of the work that we did as well was to consider those results, the results that we've had based on the changes after the pandemic was ended and after we adjusted our processes. All the learnings were really, really useful. Now, in order to conceive our new projects, we definitely have to lean on the infrastructure and the planning stage, and always considering the operation of the hospital in every step of that design. And it is essential because the main impact that the infrastructure has is during the operations, of course. And finally, the patients will be catered to. Finally, there will be a relevant impact. And clearly, in our vision, I think that's precisely where we are able to get a good understanding on the project. Yes, thank you so much. It's really interesting to hear those reflections. And it's clear, I mean, this importance that you are talking about as far as being able to predict, being able to anticipate, being able to understand how the information can be useful to avoid some issues that you've already faced down the road, and also do a better job feeding the concessions. So we are now going to hear from Rogelio Marcondes, the CEO of CELOG, from Peru, to understand a little bit the perspective of the concessionee, right? If you can tell us maybe what are the lessons that you learned, what are some of the lessons and learnings that you gathered in this operation, which touches a lot on logistics as well. So thank you so much for your presence as well, sir. Thank you so much, Anchor. Thanks to all the team of the Inter-American Bank for the invite. This event is actually really important because it's crucial to be able to share the experiences. I was listening very carefully to Claudia, and there is a lot of food for thought, and there are many topics that crisscross between our region, and there are many similarities in the social aspect as well. So just to explain, CELOG, our company is a concession, is an APP in Lima, Peru. So we are in charge of social security. We touch on roughly 6 million patients actually that we work with are users of the social security service in Lima. And our concession is already in its 15th year. And before the pandemic in 2020, we went through the first renewal that we had. So we were the first health APP in Peru, and we were the first APP concession to be renewed in the country. So we went through the contract renewal. So we were really able to do a comparison. We assessed what was produced in the first years of the concession compared to what happened afterwards. From a public perspective, we were able to assess how Lima was looking comparing to other provinces that we are not present with in terms of social security. And throughout all these years, we produced a whole lot of evidence about the impacts. And the first reflection that I can share with you in terms of all these years of experience is the APP modality and how crucial it is. It would be impossible to do the work we do with a traditional contract of public contracting, right? Because apparently, in other words, we are logistics operators, right? But that's just the tip of the iceberg. Everything that we do and the management that we do to administer the entire chain of the public apparatus, that goes way beyond just understanding the infrastructure, just understanding what the equipment is and what the team is doing, right? So that is the first step. That's the most basic aspect, which Social Security didn't include that beforehand, but connecting with all the systems, all the platforms, knowing exactly which medication in which amount at which point is applied, and training people on that, investing on quality systems, investing on good systems. So we have a lot of ISOs, and we have compliance systems as well, anti-corruption systems, because the healthcare system is under a lot of pressure due to that type of practice. So yeah, with that, we were able to put together a platform that has a very important technology component. We have changed a lot of processes through our workshops and through our training sessions. We managed to make sure that the work we do has a real impact on the chain. Because for us, part of our contract is about storing, distribution, and delivery of medication. However, we do not purchase medication. So we act closely with the public procurement systems, and we are also the users, nurses, physicians, pharmacists, and also the insurees. So working with all of these moving parts would be absolutely impossible in short-term contracts, in contracts that are traditional in nature, and for all the reasons that I mentioned, but also because of the shifts. You have a government, and an APP government has a lot of changes. We have had a lot of presidents in between. We had almost 10 presidents in the last few years of the duration of the project. So each shift, each change brings about a new development. But this is an institutional contract. It has the law behind it, and it enables us to give this continuity to the business. Even though there might be some questions, even though there might be difference in opinions on the APP model, we can still work together. We have the employees that are at the top of management and all the different areas that work with us. So that goes to show just how important it is to have this this mechanism, the APPs. And again, we are still the only APP, as far as I know, in Latin America. We are the only logistics APP in the region. That's why I was touching on the complexity of the system itself, because again, it's not just knowing your infrastructure and knowing your system, it goes way beyond that. And if I may, one other lesson that we learned is that, again, we started the project, we started the logistics operation, and throughout time, we realized that we have to change our paradigm. We changed many paradigms since we first started, but there is one paradigm, which is the level of service and how to measure your service. Because, of course, we have many indicators, we have many logistics targets, but at the end of the day, what we want to know is the real social impact that is generated for patients. In order for us to have that, in order for us to create a real impact in our patients' lives, we are convinced that we also have to intervene in a direct way with the procurement side. I mean, we have some programs that cater to patients, but if they don't have the medication because the state could not buy it for whatever reason it is, the patient is not going to be assisted. So to change that indicator, the availability of medication, we had to change into a level of service for the patient. In other words, patients serviced and catered to completely. That should be the measure of service. So all of that which is being discussed, now we are having a conversation with the Social Security Service in Peru so that all of these learnings throughout those 15 years can have more and more of a positive impact in our citizens. And yeah, so that's a little bit of my lessons learned. Ancor, we can continue with the panel. Thank you. Thank you so much, Rogerio. And absolutely, this is a real successful case. The bank has learned a lot from it. We did a lot of research about it, and we learned a lot from you folks and your initiatives. It's great to count on you as partners and hear from your experience. And I would also like to go back to Luis Eduardo and just give you maybe 2 to 3 minutes so our other speakers can speak as well. But what are some of the strategies that you implemented in Colombia to make sure that the APPs can be not only sustainable from an economic perspective, but also to incorporate more and more of the social perspective and the institutional perspective? Go ahead, Luis. Thank you, Ancor. Yes, this topic is one that we hold close to heart because we have developed many strategies throughout the years with the efforts that we made. We were talking about the last generation of concessions, and in that perspective, we worked with more mature prices and with more robust structures, and not only when it comes to contracts, but really about the institutional soundness that we need for those projects. Today we have 8 contracts, which are last generation contracts, and we know how we are working, what are the technical components like. We have had time to get a real understanding on it and how to develop a solid contract for the country and for its end users. I believe that we accumulated a lot of knowledge with our work, and that changes the way one operates, that changes the way you view things. I mean, all of the attachments, all of the documentations, all of the data, that becomes more and more relevant as we go. And as a good example, I think the risk policy comes in handy, right? We really need to understand the risks that are involved in the different projects, and that policy of risk makes it real clear who is responsible for each risk. And whoever has the best way to deal with risk will definitely have a contribution and will be the person in charge. Now, from an institutional perspective, we've had some important developments. We have 5 vice presidents so far, and each of them, depending on what comes down the pike, can have more of a participation or maybe more of a side role, but there is a nice division it goes from the pre-feasibility stage all the way to the maintenance stage, which is the post, which is after the conclusion of the project. And that becomes a nice shift and turnaround between different leaders. So with that, I think we can cater to the necessities better, we can have more synergy, and with that we can formulate a real national policy. We are considering the different models of strategies for 2026 and the new contracts. They will have some new perspectives, environmental perspectives, technical perspectives, follow-up. And that'll be really interesting for all of the involved, for all the stakeholders. And we are working closely with the environmental and social aspects as well. This is something new to us, but in our concessions, part of the CAPEX is now being directed to social issues, to something that really has an impact on the communities. So in summary, what we were able to do with this perspective enables us to be successful. So with that, we can continue to add that experience to the new projects coming down the road and continue to follow up on the impact on the region, which is really important from a social and environmental perspective. And that is why we invest. Thank you so much, Luis. And to piggyback on your comments, I thank you for the opportunity. Your agency gave us a lot of help in the evaluation agenda in the last decade, and it's really a very important effort. The agency has taken a very prominent role in terms of working with the economics of it and working with the social infrastructure. So we are really happy to be able to work with you folks. And hopefully with this new evaluation agenda that we are starting with, I hope we can work even closer and continue to the contracting stage. With that, we can have a lot of lessons learned, not only to improve the APP programs in Colombia, but also to share this experience with the entire region, which is definitely very useful. Yes, can I just add something to that? I think the experience of our agency, the ANI, that shows such good results on the national level, allows us to work in our latest plan to focus not only on the port infrastructure or the roadway system, but also on social issues that are very broad, right? So we are focusing on hospitals and schools. And in a few years, I'm sure that we are going to have some positive results. And hopefully there will be some important examples that will serve to other locations as well. Perfect. Thank you very much. Thanks a lot to you and your team. Again, you're really helpful. So we are a little tight on time, but I would like to hear from Claudia a little bit about some of the challenges that you faced on the hospital sector and how you're dealing with them. Absolutely. Well, currently, we don't really see an exclusive impact with regards to the APP side. There is no, in other words, there is no comparative analysis between the results of the different projects we undertook compared to the traditional model. We don't have that. I mean, the traditional model in our country didn't have the metrics, didn't have the indicators that we use to follow up on our projects with the hospitals. So you cannot really have a direct comparison in this way from a data perspective. What we do on our state is precisely to create the metrics to be able to have that comparison in this model of concession that is more normalized at this point. The data and the registries that we have currently, they go from a hospital, for example, say you have the National Hospital with 14,000 registries of maintenance and preventive maintenance as far as the medical equipment. However, there is a whole lot of unscheduled activity. So in these projects, we have to work with the IT systems to include everything that is happening, to register everything that is going on. And these activities that are not scheduled, the ones that are required as we go by the hospitals, it's roughly 20,000 requests per month. So in other words, 300 requests per day. So it's a huge amount of data, as you can imagine. And we really need a huge impact study. And from a healthcare perspective, we really need a tool or a system to handle all of this gigantic volume of data. And just to conclude on my point, I think, again, we have to think about that qualitative assessment, which is really important. The qualitative side is paramount. You have to apply that because the contracts, they generate efficiency, they generate quality and new perspectives, and they generate new forms of working for the hospitals. We have specific data, obviously, for the medical apparatus. So we have a certain level of detail that, I mean, it's not always applicable to all the areas and all the contracts. So we've been doing more in a more broad evaluation, a more qualitative evaluation, to have the processes of replenishment in place, the resupply, if you have to write off, if you have low availability, or you always need to have a plan B, is what I'm saying, so that the hospital is always ready, always online. I think that's essential. So measuring that becomes really, really crucial. It's a very interesting analysis when you go into it, and that can be taken to other areas of the country and other departments as well. And finally, in terms of the points of discussion here, for the purpose of comparison, we have to reinforce our governance between the ministries, for sure, especially when it comes to health and finance. There are some changes that are necessary. Today, our main there are some issues that have to be dealt with, and sometimes it takes a cultural change from an administration perspective, because hospitals that have a traditional model can really benefit from the APP format. I want to make that clear, because this is something that requires focus, this is something that requires our dedication, and we have to be really transparent to be able to tackle future projects and to be able to successfully conclude the ones that we have at hand. And with that, we can improve the process overall. And from this perspective, I think we have a nice orientation towards the main challenges. We are focusing on the most relevant aspects, and I think we can have an even more robust culture in this sense. With that, we can, develop the projects, but the pathway that is lying ahead of us is one of a lot of dedication and focus on the patients. That's the challenge, really. Absolutely, Claudia. Thank you so much for your comments. There are many useful things about what you said, especially when it comes to do a proper comparison between the different models. And there is always a lack of information, right? These are very complex systems. So we really have to be careful when it comes to the comparative analysis to have an idea of the real impact of the investment in the projects. Yeah, but with that being said, I mean, the Chilean experience is fantastic, and the work that you folks do is really outstanding. And it puts you in a very privileged position to be able to develop a whole set of additional tools that helps in the management of the region, right? In terms of moving towards the operational side. And yes, with that, you continue to work on that aspect, which is essential for Chile and the region. Absolutely, Anchor. This is a necessity that we have, and we are happy to be able to contribute. Absolutely, Claudia. So, to conclude with his last comments, I'll hand it over to Rogerio. And if you can comment on that perspective of the concessionee and what is the social impact that you can have as you focus on the user, as you tackle the different issues. Thank you so much, Rogerio. Go ahead. Thanks to you. I see that my image is a little like a phantom. Yeah, there's some colors here. But anyway, we had a lot of impact investigation in our work. We did some studies with the Berkeley University to measure impacts on this logic of distribution that the health system has. We had a model just in case, and we changed it to a model of just in time. And our contract, as well as the other APP contracts, are highly regulated. There are so many indicators on it, and all of the indicators, I mean, we have some measurements that are above 99%. So it's very, very exhaustive in terms of the indicators, but also at times we are trying to work by ourselves to go after consultants, to go after universities and academia, to try and evaluate the impact that we have. And one of the main impacts is precisely about the essential part of our work, which is the citizens, which is the patients. And we are able to have that, for example, I mean, we have two programs, which is a delivery program for medication for patients that have chronic diseases in private pharmacies. And the level of satisfaction for patients that can go 5 minutes away from their homes, get their medication in the pharmacy is huge. I mean, they can reduce transportation costs. They can just go to their local pharmacy. So the impact is right on their pocket. So patients really have more of a facility. They don't have to spend too much with transportation. So they save a lot of cost with that. We also have a home delivery service. Thousands of patients receive medication at their homes. So again, there is an impact because they save cost, they save time, they don't have to go depend on or rely on transportation. They save roughly 300 soles with that. So all of that goes back to what we were discussing before. For us, we are part of this healthcare system. We are in charge of managing the hospital processes so that there won't be any delays on the supplies. We have had an essential role during the pandemic. I heard what Claudia said about the pandemic, and we moved very fast at that time. We did not allow us to fall back. Quite the opposite. We increased our workload. We increased the service to our provinces, and that's what I go back to. I mean, the essential part that we've been able to work with patients, and we're able to measure the impacts that are generated directly. So with that, we can focus. We have a lot of savings that we can help patients with. They don't spend that much with, I'm not going to give you all the numbers because I know we are tight on time, but all the numbers are available. You can see it. It's of public knowledge. And with that, we can really share the experience. But thank you so much for the space, for the forum. Thank you so much, Rogerio. It's great to hear from your experience because your case is very unique. This is a perspective that we don't get all the time. I mean, in terms of all the logistics of medication, and with Salog, your company, this is a very unique process. There are very few cases that are comparable, not even in the region, but also in the world. Well, I think we took 1 minute extra from the next panel. We have Eduardo Cavallo that is going to continue, so I'm not going to extend myself. Thank you so much to Rogerio, to Claudia, and to Luis for their excellent comments. And I invite you all to be present in the PPP Americas in Lima. Thank you so much. Thank you.
Y a todos los panelistas.
Thank you to all the panelists. Really an excellent panel. And now we are going to move forward to the second panel, which is going to focus in the evaluation of impact of the APPs. The focus is how to modify concepts and methodologies to do a proper measurement of the impacts of these projects from an economic perspective as well as social. So for this much, our moderator is Eduardo Caballo, the main economic assessor of infrastructure and energy for the BID, an expert on these topics with a lot of experience on analyzing the impact and the information of these projects. So I'll hand it over to Eduardo. Go ahead. Thank you so much, Carolina. And a very good morning to all of you that are joining us online. Thank you so much for the invitation. The unit of APPs that conducts this event has worked quite hard. Thank you so much to our hosts in Peru. And to me, it's a real pleasure to be able to tag along in this journey, all of those discussions, and to be able to participate in this work group. And on that note, to continue on that topic, as our colleague said previously, this is an area that is in its inception, which is the assessment of APPs. The impact evaluation is still quite new. So in this panel, what we want to do is we want to start a dialogue with regards to this topic, and we really want to unify some concepts. We have a very distinguished group of panelists that are going to be joining us. I'm going to briefly introduce them. We have Isabel Busetti Horta, which is the lead of the Social Evaluation Department and the General Direction of Concessions for Public Works in Chile. Isabel is an expert on evaluating public policies and projects in Chile. We also have Mara Souza, who is the director of the Special Secretariat of Alliances and Inversions, which is, the acronym is CEPI. Mara is a key player on structuring the APP projects in Brazil. And we also have Ivan Lucic, the coordinator for the functional unit of data analysis, investigation, and strategic intelligence from Proinversión in Peru. Ivan really stood out in this space. He works on optimizing the implementation of infrastructure projects in Peru. Well, I cannot conceive a better panel to start that discussion and to talk about the evaluation of impact. And I want to start with a general question, so that all panelists can tackle it. We're going to hear from each and every one of you. But yeah, I would love to hear from you what is the vision of your country, in your context, with regards to the institutions when it comes to the impact evaluation, and more specifically, what has been the progress so far, and what are some of the perspectives that you are considering for this space, for that development in the future. So let's start with Isabel. Thank you so much. Good morning, everybody. Well, to me, it's an honor to be a part of this conference and part of this conversation. And well, the concessions in Chile had, that story has been in the making for 30 years. We have learned quite a bit. We have done a lot of evaluations of impact as far as our institutional framework. We created an institution for concessions and also the regulatory framework for the environment. But I think the major progress that we had was based on the lessons learned after we did a proper evaluation of our projects, after we actually implemented that process. And those lessons learned, especially when it comes to the territorial and the environmental side, all of that was documented. All of that was turned into plans for sustainable management, for management of green areas. And now at this point, we are taking this data for a tender process so that all the bids can be maintained. We are talking about complete comprehensive studies where we have a lot of citizen engagement. So we listen to citizens, we listen to the institutions and the projects. They don't just pop up in the sector, right? So they go ahead and collect all the necessary requirements. They get the populace involved. And I think one point that is interesting for us to comment, perhaps in terms of our progress, is the feedback loop. That feedback process, it's really important. And yeah, that is to say, we hear a lot from our citizens, we hear a lot from the populace, but they also forget. I mean, if you ask something that happened about something that happened 10 years ago, it's not as fresh. So it has to be a continuous process. We have to continue to listen to folks and keep the communication channel open. One other important point is that in this process, we learned that projects are living things, right? They are moving bodies. They are always ever changing. You have new requirements, you have new challenges that come up, and you have some important projects to consider. There always can be some blind spots. So with that in mind, we can have a new gaze, we can have a new perspectives, and that makes us into good neighbors. This is actually the name of our project. Thank you so much. Thank you so much, Isabel. I have this very strong idea in mind, which is the need to learn from the lessons of what has worked and what hasn't worked, and also to incorporate the perspective of our beneficiaries, right, in those programs and plans. But allow me to hand it over to Mara so that we can hear from her perspective in terms of the Brazilian experience. So Mara, I will ask you the same question. Thank you. Thank you so much, Eduardo. My apologies because I will be speaking in Portuguese, and I think everyone can hear the translation if necessary. So first of all, I will thank PID for this event, and I feel so honored for being here and share with you this experience of Brazil. We have had some very interesting experience, but basically we work with policy evaluation. We don't evaluate the strategies of implementation of these policies. Well, back in 2023, the Ministry of Planning created a very specific secretariat to evaluate public policies and economic matters, which the objective is to enhance policies and use the lessons learned to implement better policies and to institutionalize the review of expenditures. There is a component here which is to improve the quality of public spending and also to communicate and assess with managers in Congress. Afterwards, I'll tell you a little bit about how Brazil is comprised as a federation, and I'm very envious of Chile in this regard because Chile has a more, shall I say, a more organic situation because they have more centrality. In our case, for this matter, I think that we could be at a disadvantage. Of course, there are many advantages on being a federation with a lot of entities and with a very significant decentralization. In some areas, this comes in handy, but in some areas, we're not as happy with it. And evaluation is one such area where we struggle a little bit to go to the very end of the process, to penetrate all the way to citizens, to reach them. Because from a federal perspective, we launch public policies, right? But the implementation a lot of times is up to the state and municipalities, especially when it comes to social policies. So with this logic to actually do an evaluation of impact with citizens, there's a lot of roadblocks. There's a lot of setbacks on the way. Our evaluation process is very diverse. We do budget analysis, performance analysis, diagnostics, governance analysis. We also analyze implementation, results, and also the impact. But like I said, the objective, or rather the more specific way to do that impact analysis, is to do a cross-sectional analysis of the policy. And we don't really look at the different results we could have when we compare an implementation of a PPP with a traditional public project or some other forms of contract that the government can do. So the objective of these models, or the objective of these public policy assessments, is to improve decision-making, strengthen good practices, and contribute to the efficient public spending, and especially to communicate society at large what was the result of that policy. I have some documents that is generated by Brazil. I'll make them available on the chat if you want to share them later. We have documents from the control bodies, the agencies that actually assess the public policies, both external, such as the Accounts Tribunal, as well as internally, which is the CGU, which is the agency in charge of the internal control from a federal perspective. And I also have a report, which I find very, very interesting. It's an annual report of public policy assessment. The objective of this report is to do a general overview of the policies and to summarize the main points that we have to improve from a concept perspective. So we analyze health policies, we analyze education policies, logistics, and mobility. And then from that, we summarize it into a single document, which I'll share with you. This is my comment, Eduardo. Thank you.
Muy bien, muchas gracias.
Okay, thank you so much.
Perdón que saco la traducción, es que estaba...
Let me just turn off the translation for a second.
Sí, no,
I
estaba
spoke very
procurando
fast.
no perder justo.
No, I was just trying to stick to every word you said, but it's really interesting, Mara. Thank you so much for that perspective. Of course, Brazil is a very different country in its context in terms of its infrastructure from a federal perspective, and of course, you have your own challenges for that topic. Thank you so much for giving us an introduction on that. So I'll hand it over to our next panelist, and I'll ask the same question to Ivan Lucic. Welcome, Ivan. And the same question is asked to you. Thank you so much, Eduardo. Greetings to you and to all the members of our panel and all the people present. Well, in Peru, the vision of the country when it comes to evaluation of impact, that's a very recent vision, right? And basically, this is focused on the National Plan for Sustainable Infrastructure for Competitiveness, which is known as PENIS. So we have this, of course, we are in 2025, but this document right here has the entire strategy for infrastructure in the country, where we have basically 72 projects and different sectors such as transportation, communication, basic sanitation, as well as energy. But we can say that you have the main sectors, and we are incorporating the vision and the strategy of each of those sectors, right? Defining some criteria for prioritizing the projects. So the project prioritization considers, of course, the environmental dimension. The institutional dimension is really important as well. And one has to consider the social dimension as well. In our agenda, we have to develop the concept of sustainable infrastructure, and we have to apply that in all the sectors, especially when it comes to the infrastructure. So the interesting thing is that in this plan, we have some social sectors, including the health sector and the education sector. And those are quantifiable, right? So we can highlight the importance of incorporating tools to evaluate the results at this point, because The purpose is to make sure that the infrastructure of public powers that has to do with, of course, we have to have a significant impact. So we incorporate the sustainability principle as of 2023, and we consider this to be a very important advancement because we already have our framework to be able to work in sustainability and also to evaluate the impacts on those three dimensions. So from the perspective of the agency, promoting these values is really important. It's really important to have that functional relationship as far as the investigations, as far as fine-tuning the intelligence and the strategy, because throughout those 15 months where we've been working, we have been able to come up with special studies and documentations and technical investigations that have a lot to contribute to the agency. And those create the evidence of the importance of the public and private institutions and how important it is to develop the country. We have therefore 5 studies that have been peer-reviewed. We have had the support of BID in that space, especially in healthcare. We also have a study on the port terminal. This is a documentation that is published, that is of public knowledge. You can get access to it. And we also have the economic impact investigation for the telecommunications projects. That includes the access to internet in the different regions of Peru, and also the impact on the public healthcare system. That includes places like Cajamar and Cusco. We have the evaluation of APPs as a public sector, and the congestion of the public facilities in Lima. And with that, we use different methods to evaluate the impacts. And in a very didactic way, in a very clear way, we can see all the benefits involved. And it's also important to mention that Pro Inversión took part on a great deal of reanalysis in these alliances, public and private. We were able to present studies in 2024 related to the methodologies of impact evaluation on the infrastructure. And this recent effort that has been done, that has contributed a great deal, and the country has seen a major advancement when it comes to the indicator from 2023 all the way to 2024. And indeed, there's a lot to be gained in exchanging experience between the different countries of the region, through this back and forth of studies and different technical investigations that assess that practice. Thank you so much. Thanks to you, Ivan. Really, it's really very interesting to hear from that experience that you have generated in Peru. We are definitely going to touch on that in a second again. So now we heard from the general experience and the general learning. So I want to ask to each of the panelists a more specific question, starting with Isabel. Well, Isabel, considering the level of progress that you have seen, you talked about the Chilean experience a little bit. So what do you believe are the key indicators? So what are the key indicators that your team utilizes to be able to evaluate the economic and the social impact of the APPs? So go ahead and tell us, what is your take on that specifically? Right, so from a Chilean perspective, all the projects that become a reality in the state have to go through a filter, and the filter involves the ministries. You also have to go through a number of cycles. You have to go through a number of processes that have to be respected. So that would be the main indicator. As far as how we measure, as far as how we select and choose the different projects, well, that happens through a number of criteria, right? So we have some criteria that is very evident that that the other panelists make use as well. We have all the relevant variables that to be considered, the effects on the environment. So yeah, all of those priorities, they generate indicators and analysis, and also the associated cost. Well, I think that today we have a very interesting scenario. We have better institutions and more solid organizations involved. Back when we didn't have the system nice and set up, all of this information were really, they were less relevant to us because we were evaluating things that we didn't know how to measure. So now we are in a much better space. We have partnerships with other ministries, which is key. And I think time becomes a benefit afterwards, because we are able to save time when we have more exchange. And sometimes projects have very important benefits that are sort of lost, that are not captured. One such case that we can talk about is the case of a hotel. I think for now, just to give you a more concrete case, we have a railroad that connects two capitals. This is a project that not only provides people with savings, but there is also some cargo-related benefits which help on the development of the country. If we can have a good exchange with the ministries, we can have benefits all across the board. We can work, for example, with the regularity of the transportation service and the ability to do territorial assessment and to do an impact analysis. And I think that's what it is, to have an exchange with the different ministries, with the different agencies. It's important to assess this coordination across different ministries. And yeah, you can, in this way, work with the railroad company, which is a state-owned company, but also has its autarky. You have the trains, and you can have a Ministry of Transport that enables you to think about an efficient system, about a system that is done right, that has the environment in mind. And yeah, the idea is to bring new infrastructures, new divisions, the Ministry of Development and Family, which is the one that oversees a whole nother aspect, and the social benefit has to come with the construction. In conclusion, we have a new agency for this much, which aims at producing a more spot-on assessment and generates some indicators for the territorial assessment so as to crisscross the information. We also have a system of, we have a system of geographical information to try and divide the project in different areas, and considering aspects that you cannot really quantify if you look at the project in an integral way. We actually have a graphic interface, which is really interesting, which we use to evaluate the different aspects and the different criteria. We have an evaluation in a scale of 1 to 5. Basically, it's an initial evaluation to see if that is in line or not. Each one of these aspects, improves connectivity, improving also bike lanes. security. There are so many aspects that are considered in a construction project, and with a color-coded indicator, you can actually see very visually if the project is having an improvement or not. So these are some alternatives. You know, this pilot project that we are doing in the country at the moment is really interesting because it's an example of analysis that are done by sectors. So with those analyses, we can see the project is much more complete. Thank you so much, Isabel. Very clear, a very complete answer. So at this point, I'll hand it over to Mara. So Mara, you have a more comprehensive vision of Brazil. So in your opinion, what will be some of the challenges for the coordination between different institutions to make sure you have an effective evaluation of the impact of APPs in Brazil? Well, like I said before, Brazil is a federation comprised by the federal union. It's 27 states and over 5,000 municipalities. Constitutionally, all of these entities are independent, and depending on the type of public policy that is being implemented, each entity has a certain responsibility and autonomy to implement that policy. So that in and of itself is already a major challenge for the general evaluation model, and it's even more particular when it comes to APPs. Considering this broad scope, to implement an evaluation project is never easy, and it really requires a lot of attention from the different stakeholders. As we assess the healthcare APPs, for example, we have PPPs that are on the municipal level and the state level. We are now starting with the federal level. So when it comes to doing an evaluation by using that APP mechanism, I mean, imagine the complexity. I think we have 12 APP projects in health, and you have to negotiate with each entity so you get access to the data. So that coordination is a very sophisticated process, which calls for a lot of skill to be managed. Just like different countries, we have different ways of implementing policies, whether it's public constructions or other models, but we still don't have an in-depth vision on the different extraction of the APP model, so we can have an actual assessment on that impact compared to the traditional models, just like Claudia said in the previous panel, right? I mean, the projects are not one and the same, and if they are not one and the same in Chile, which is a country that is more centralized, I mean, imagine having that on a federation, right? So for the evaluation side, in our government, we use the British model, which is a 5-dimension model, where you consider all of these elements, you know, the social impact, the economic impact,
ambiental,
the environmental impact, but that is a prior study, right? We are doing what we call the accent evaluation, and in Brazil, all of those are mandatory. So before you do any APP project, since 2021, if I'm not mistaken, you are obliged, I mean, the entity is obliged, whether it's the ministry or a public company or a private company that is going to implement that project, that company has to do an assessment of the project. We want everyone to use this instrument, and we are doing a whole training process, so at some point this can be implemented. Now, overall, except for economic infrastructure projects, especially when it comes to energy and communication, maybe I forget something else, but the projects, which in this case are really specific, the public policies actually confuse and mingle with the model, because when the concession and APP model was implemented in Brazil in around 1995, well, that model completely transformed. So you have some uniformity to it. Very few states in Brazil don't have energy concession, for example. When it comes to telecom, you know, phone and cell phones, this is a federal project. So all of those are concessions. Now, in this case, you were able to do an evaluation. But when you work with different policies that have a very strong implementation, especially social implementation, it gets harder. it's a lot harder to implement the evaluation models. So when you consider the size of the country, it's a vast territory, it's a lot of stakeholders involved and different models of public policies. Usually, we don't assess the implementation models. So we don't separate the APP model from the traditional public construction model. Because when it comes to APPs, we started in 95 with the concessions, right? For roads, for telecoms, for the energy system. And in 2004, when we published the APP legislation in Brazil, to have more of a focus, more of a detail. I mean, it's not only social, but other areas. Up until that point, we had the evaluation impact, in a very traditional way. We didn't segment it. Since we don't have such a tradition, we now have a partnership with BID, so we understand what are the strengths and weaknesses in the APP contract format we have, and we are already working on it and trying to improve based on those results, trying to improve the new contracts and contract renewals. The major challenges that I see for that partnership, which we established with BID, it has to do with the methodology design, right? So the diversity of different projects and the difficulty of comparing that with the traditional model. That is the first element that we have to consider. We have to think about it in a very specific way. We need a solution to be able to evaluate, those elements. So lack of uniformity and consistency between projects, this is very significant. When it comes to Brazil, the APP universe is still a small sector when compared to the tradition that we have on public construction. If you think about schools and all the school infrastructure we're just getting started now. Health, we started the first project in 2008 with one hospital. It was inaugurated in 2010, actually. So from then on, I think we've had 12 projects on healthcare, compared to the enormous apparatus and the huge number of offerings that we have for health in the country. I mean, the impact of a PPP in the country is small. There could be an impact on the community for sure. And some other cross-sectional elements that we are always paying attention to has to do with communication. I don't know how it works in the different countries of LATAM because I don't have a lot of experience outside of Brazil. But in Brazil, we have this tradition of focusing on the negative. So whenever we do an assessment, we have the negative and positive aspects. But what shows up, what is clear, what the real repercussion, whether it's in the press or the social aspect, is always the negative side. It's always what was wrong with the policy. And so with that, public officials are tense because even though the project might be 99% positive, what's going to be scrutinized is that 1%, is the failures and what could be improved by improving, the management of the project or maybe the contract aspects. One other element that we have is getting the adoption of different stakeholders to the PPP. And finally, it's really important to train the different members of that process so we can actually implement what was planned at first. And with that, you have the different adjustments in the contract, which could maybe distort its original form. So you want to improve the project. And so we have a major program, and the BID is definitely one of the main partners to train those entities to make sure that they can tackle the projects in the best way so that we can deliver actual public policy in the best way. And with that, we'll have a coherent evaluation impact. And we're confident that this partnership with the BID will help us surmount our challenges, and we hope to be able to contribute with the improvement of our country and also in LATAM. Eduardo, thank you. Very well. Thank you so much, Mara. I am sure that this will happen. I'll hand it over to Ivan Lucic. The question that I have for Ivan is the following. Given your role as the coordinator for the study unit,
la unidad de estudio en el largo plazo? ¿Cuál es la visión?
What is your vision in the long term?
En este contexto?
What is your outlook in that context? Thank you, Eduardo. Well, Raul Garcia spoke before me, and he left a very high bar because he had a great team of professionals that were, that were responsible for the 5 work documents that have a serious academic impact. So big shoes to fill. So that with that, the agency became a reference in the region when it comes to evaluating the impact of the APP projects, especially when it comes to the long-term impact of our infrastructure. And of course, that has to do with the strengthening of that analysis of investigative data and strategic intelligence. It's strategic because it's going to enable us to work better with academia and with external consultants, and to do what we failed to do for a long time, which is strengthen the analysis units, because these are the ones that provide the evidence that support the public policies, right? And along those lines, we have to underscore the studies to improve the process of structuring the different projects of APP and extracting the lessons learned and the different ways for the structuring of APPs and the different mechanisms of investment that we have for the infrastructure side. So on that note, it's really important to present evidence to corroborate the advantages and disadvantages. So from a transactional perspective, it's also important to do an analysis of the dynamics of the global markets as well as the regional markets, to be able to promote competence and in this way achieve better results in the adjudication processes. On the other hand, we also have to continue with the impact evaluations that are being done in order to quantify the benefit of projects through the APPs in the influence zones. And these projects have to incorporate a territorial focus. However, besides that, we also have to give it scale. We have to scale it up by conducting studies that will quantify the impacts on the regional scale as well as the national scale, given the portfolio of infrastructure projects and public spending that are supposed to promote agency, and also incorporating other modalities of private participation, such as the mechanism of active projects that the country is doing to go back to its dynamic state, and also considering the impact from a demand perspective and the impacts that are generating on the supply side, right? So we consider that these projects are really important because they stand to contribute a lot by expanding the production ability. So with that, we have to evaluate the impact that this frontier has, because that is going to enable us to identify new business opportunities and new investment opportunities from a private perspective to each one of the regions of our country, without forgetting that these analyses contribute to the macroeconomic development of the country, because after all, it is necessary, with this macroeconomic analysis, to have more of an approximation to what needs to happen to achieve GDP growth that is above 6%. And I think that there is a space here, there is an opportunity to expand that frontier, especially in Peru, and have a very interesting growth as a result. Thank you so much, Ivan. Thank you so much for your comments and the reflection here.
Nos hemos excedido unos
Well,
minutos
we went past 1 minute of our deadline, but I believe it was worth it. I want to thank Isabel, thank Mara, and thank Ivan for your excellent comments, for your excellent interventions, because these are some very relevant topics. And this is a very interesting from a perspective of different countries. Now, without further ado, we are going to take those reflections into account. Thank you so much to the organization, and I'll hand it back to Carolina. Thank you so much. Have a great day, everyone. Thank you so much, Ivan, and thanks to all of us, all of you who participated. I just wanted to express my honest thanks to our panelists for their valuable contributions and to the moderators for guiding us in those very rich discussions. And also, I want to say a deep thanks to all of our sponsors, which made this event possible. Your continuous support is essential to the success of our initiatives. We see you in April in this great PPP Americas 2025, which will be broadcast completely free of charge, digitally in English, Portuguese, and Spanish. If you want to participate in the event, again, on the digital side, please join the APP community so that you can receive the necessary updates. I invite you to scan the QR code that is now going to show up in your screen. Thank you so much, and see you in April.